So we are now representing Spanish projects as members of MUD organization, but actually we are originally Finnish company, so that's of course funny, but we are not from OULU. So Evondos is providing medication administration solution for people living at home. So we are supporting people to take the right medication at the right time. Of course, related to OULU, we have some connections. So in OULU, they are currently using more than 700 of our robots in home care. And that corresponds about 20% of home care clients in OULU. And I think the situation is quite similar in Spain and Finland, that number of elderly is growing. And we have a solution to prevent the kind of consequences of that. And my name is Mika Apel. I'm founder. So we have been working around medication administration from 2008 already, came to market in 2014, and all started in a university project and experiences with my grandmother and the old red kind of traditional dosage. So care organizations visited regularly to give the medication, and they didn't have time to spend and talk with my granny, and that's why we thought in a project that we need to develop something else and help. And our solution is medical device class 1. It meets the standards on European markets. So we have lately also been granted information security certificate 27001 and 13485 for the quality management system. We are one of the fastest growing companies in Europe, so having about 40% annual growth rate. So currently tens of thousands of users in all those markets are taking medications from our robots, corresponding about 100,000 taken medications per day. And so we are scaling up fast in the Nordic markets and also in the Netherlands. In Spain already we have, so of course here we are representing our internationalization. So we are now active in Spain and London, UK, and there are especially London, Madrid, and about 4 different locations in Spain already being implementing our solution. And during the years, we have already given more than 30 million pills or 30 million doses at home to our clients. And why we are here or we are existing is, of course, there are very big challenges in all countries. So demographic change, aging population, one of the mega trends in the globe. And for example, in Spain, I just read that about 1.5% growth, annual growth in number of people over 65. And we need ways to keep them healthy and independent. And additional to that, that 20% of people are taking 80% of the healthcare costs. So that's why we need to focus on, and that's why also I think we are here to introduce new digital solutions to help people staying healthy and independent. So our proven value proposal is increased patient safety. We are providing 99% medication compliance in the Nordics. We are creating cost savings for medication management provided by county councils. And then, of course, there are a lot of personalized quality factors. So in each product, there must be, of course, it must be easy to use. And then on the other hand, they must meet your personal preferences. And I think there we have strong win with Evondos, and that's why we are growing that fast. And considering what we can, okay. Now it's stuck. No. So considering Spain, what we can provide to Spanish and what we are working on. So of course, typically in elderly, there are a lot of different diseases, having dementia, having Parkinson, diabetes, different long-term illnesses that need medication. And mainly people who benefit most are people living at home or independently. And then on the other hand, home hospitalization is one that typically also medication compliance is risk why you need to keep people at the hospitals. And then those same benefits, patient safety, medication adherence, and also we have a separate telecare system where we can trace and provide transparency to healthcare people about the medication taking and related exceptions. And it's very easy to use it. So it's basically a robot where there is one lit button when the medication is available. It's speaking your own language. It's speaking here also all Spanish languages. And if you didn't take the medication in time, it will send alarm to the care organization that they know to act. So this, of course, if you think about adherence, so about 50% of medication is taken according to prescription. So this 99% is very high figure in that sense. And there is a lot of applications also related to governmental level that what does it actually mean. For example, if you don't take the medication, so that medication is wasted and it will not bring the outcome you are after. And this kind of shows the cost of different level of care. So of course, if you are independent at home, so the cost is 0. But when you need to start home care services, if you cannot support elderly living at home, so that will mean that they will need more care. They will be institutionalized to care homes and later also hospitalized. And that's typical cost, kind of cost and challenge with the poor compliance of medication. And of course, working from in Nordics already 10 years, so we have a lot of the evidence available. And I wanted to give some examples from the first projects in Spain. So in one project, we gave close to 3,000 medications. We reached compliance 99.7. Client satisfaction was 4.5 of 5. Ease of use 4.8, feeling of security 4.6. And it's actually quite amazing that how much stress medication also causes to people who have a lot of medication. You can also imagine yourself taking antibiotics, how hard it is to always remember to take them. And considering a lot of medications per day. But this is something we can definitely talk more and provide you the ones who are interested. And what we provide is increased medication adherence and safety. So that's what we can provide to you. And so you asked about the expectations towards MUD. So I think I would mention 3 things. So one is networking, of course. So this kind of events, of course, benefit us to meet other companies and perhaps do some projects together. And then also kind of finding pilot opportunities to do some local pilots to prove the local benefits. Because of course, health and social systems are different in different markets. So we also need to get them working, for example, in terms of funding. Excellent. Thank you.